For a lot of guys, a simple, routine blood test can suddenly become a huge source of anxiety. I'm talking, of course, about the prostate-specific antigen, or PSA test. But what if there was a way to make that whole process smarter? Today, we're going to break down a really fascinating new European study that looks at how a plant-based therapy could help literally thousands of men avoid invasive and stressful procedures. Right? This is the question. It's the one that causes so much stress. You get a result that's a little high and your mind just immediately jumps to the worst case scenario. But the answer to this question, and this is so important, is a big, resounding no. And understanding why that is, well, that's the key to a much smarter way of looking at prostate health. Okay, so let's dive right in. Before we can really get why this new research is such a game changer, we have to understand the core problem with our most common screening tool. And that's what we're calling the PSA test dilemma. So for years and years, the PSA blood test has been the go-to, right? It's the first line of defense. It's a simple, widely used marker that doctors have relied on to screen for prostate issues and figure out what to do next. And look, the stakes here are really high. To put this all into perspective, prostate cancer makes up a staggering 23.2% of all new cancer cases in European men. That makes it the most common malignancy, so having effective screening is absolutely critical. Okay, but here's the massive catch. This is the heart of the dilemma. A high PSA level doesn't actually mean you have cancer. It's much better to think of it like a general check engine light for your prostate. It tells you something is going on, but it doesn't tell you what. And that lack of specificity is what creates all the uncertainty and anxiety. I mean, just look at this. This shows you all the different things that can set that alarm off. You've got benign enlargement, which lots of men get as they age. That's BPH. You could have inflammation, either acute or chronic, which is called prostatitis. You might even have some low-grade inflammation you don't even feel. So as you can see, all these really common non-cancerous conditions can flip that switch and trigger a high PSA, leading to a huge number of false alarms. So that check engine light comes on. What happens next? Well, that brings us to the next, much more serious step in this whole process, the biopsy. Look, a biopsy where they actually take little tissue samples directly from the prostate, it's the only way to know for sure. 100% confirm or rule out cancer. It's the gold standard for diagnosis. But, and this is a big but, it is not a minor procedure. It's invasive by its very nature. And that invasiveness, it comes with a whole list of potential downsides. We're talking about real risks like infection and bleeding, not to mention the pain, the incredible anxiety around the procedure, the waiting for results. It all comes with a financial cost and can seriously impact a guy's quality of life. And the real problem is, because the PSA test is so vague, a whole lot of these biopsies end up being negative. So you can see why all these unnecessary biopsies got researchers thinking, hold on a second, there has to be a better way. And this led to a really cool new hypothesis that just reframes the entire problem, focusing in on one of those key culprits we just saw, inflammation. And this is it. This is the brilliant what if at the heart of this new study. What if, instead of jumping straight to the idea of a biopsy, we first ask, could this high PSA just be a sign of simple, treatable inflammation? Because if you could treat that inflammation and then the PSA level goes down, well, you might be able to avoid a biopsy altogether. And that's exactly what this major new European study decided to test, using an approach called phytotherapy. Now, that's just a fancy word for using high-quality, standardized plant-based medicines that are known to have really good anti-inflammatory and antioxidant properties. And listen, we're not talking about some tiny back-of-the-napkin study here. This was a serious, multi-center clinical trial. It was conducted across 8 different research centers in countries like Italy, Norway, and Denmark. They really put this what-if question to a serious, rigorous scientific test. So how'd they do it? Well, the method was pretty straightforward. First, they identified the exact group of men we've been talking about, guys with elevated PSA who were already on track for a biopsy but didn't have any other obvious red flag signs of cancer. Then they randomly split them into 2 groups, and each group was treated with a different high-quality phytotherapy product. After a period of time, they measured their PSA levels again, and then the doctors had to reevaluate. Is a biopsy still necessary? Okay, so the million-dollar question, did it work? Did targeting that inflammation with these plant-based therapies actually change things for these patients? Well, the results were incredibly promising. The results were pretty striking. For a really significant number of men in this study, the phytotherapy worked. Their PSA levels actually dropped. And for many of them, the drop was so big that the doctors completely changed their recommendation. The biopsy was either put on hold for more monitoring or, and this is the best part, it was canceled entirely. Now, it's super important to understand what the researchers are saying here, because this is a vital takeaway. This isn't about ignoring cancer risk or being dismissive. Not at all. It's about being smarter. It's about being more precise. It's about filtering out the guys whose high PSA is probably just from inflammation, so they don't have to go through an invasive procedure they don't need. So what's the big picture here? What does all this mean for the future of prostate health, and maybe even for medicine as a whole? Well, the implications are actually pretty profound. What this study does is it gives doctors a brand new tool for their toolkit. It's not a replacement for anything, but it's a safe, non-invasive step that a doctor and a patient can take before jumping to a biopsy. It's kind of like a way to clean up the signal and get rid of the static. So you might be wondering, who is this really for? Well, the ideal person for this approach is someone with a slightly elevated PSA who doesn't have any other worrying signs, like from a physical exam. It's really perfect for anyone who wants a more conservative, patient-focused path that doesn't just immediately jump to the most aggressive option. And really, when you zoom out, this is all part of a huge positive shift that's happening in medicine. The goal is to move away from a one-size-fits-all playbook and toward a much smarter system that cuts down on overdiagnosis and overtreatment. It's about making sure that people get the exact care they need and only the care they need. And that really leaves us with this big forward-looking question, doesn't it? Studies like this one are showing us a path forward. By intelligently using low-risk options to get a clearer diagnosis, we're not just improving statistics. We're actually building a system of medicine that is not only more precise, but also fundamentally a lot more humane. You know, for a lot of guys, a simple, routine